It's the new normal here in the Bay Area. Hunkering down, washing your hands, keeping at least 6 feet away from everyone you don't know. Medical producer Molly McCrea joins us now in San Francisco. Molly, when will we actually know if our efforts are going to make a big difference?
Liz, we keep seeing these new cases going up every single day in practically every single county here in the Bay Area. And we're going to know that our efforts are working once that number peaks and it starts to go down. And that, you have to realize that COVID-19, an infection, takes anywhere from 2 to 14 days to incubate. So we're looking at perhaps anywhere from 4, it could be as long as 8 weeks. But once we see if we can turn that corner and the numbers start to decline, that's when our efforts will be worthwhile.
That's what we're looking for. Okay. Molly, we heard today from the FDA about treatments in the works, including one involving plasma. Can you tell us about that one?
Oh, Liz, it's really intriguing. It's called convalescent plasma. The idea is that you take plasma from a patient who has recovered from COVID-19. And from the plasma, you're going to remove antibodies, and then you give it to somebody who's either at high risk or is already sick with COVID-19 to see if it deactivates or it fights or neutralizes the virus. It's worked with SARS. It's had some benefit with Ebola and also H1N1. A lot more work needs to be done in order to see whether this will work or not.
And we're also looking at an anti-malaria drug that's been around for decades, right?
Oh, yeah, chloroquine. Chloroquine was manufactured, was that in the 30s or 40s by Bayer. And the idea that this anti-malarial drug may have broad antiviral properties. And right now, I think there's some preclinical work that's being done in China with some of their sick patients. And so we'll have to see if this has any benefit to patients here in the Bay Area in the United States.
Yeah, that would be remarkable. One last question, Molly. A Bay Area company has potentially a home testing kit for COVID in the works?
Oh, yeah. This makes a lot of sense when you think about it. This is San Francisco-based Neurix. They've been testing for years, STDs. They've done home tests working with an accredited lab. The idea that you take an online questionnaire, you fill it out, and you see if you're at high risk for COVID-19 or not, because not everybody still can get access to a test. They send you the kit overnight based upon the answer to the questionnaire. You swab your nose, you stick it back in the mail. It's a prepaid envelope. It gets shipped back within 24, 48 hours. You'll get your results either on the app or on a web-based account. And it makes sense when you think about it, because then you're not going outside. Remember, you're hunkering down. You're trying to reduce exposure to this virus.
Right. Leave it to the Bay Area to come up with potential solutions to figuring all of this out. Molly McCrea, thank you.